This is Dr. Joe McEvoy from Duke University in North Carolina. I'll be talking about anti-psychotic, in quotation marks, medications, because largely what I'll be addressing is the expansion or dispersion of the use of these medications into numerous other psychopathologic syndromes that may have some but minor degree of psychotic features as part of their presentations. We must recall here in the first slide labeled chlorpromazine that the first antipsychotic was discovered, appreciated by a surgeon using the drug as an adjunct to anesthesia, noting that it led patients to have fewer spontaneous movements, to become settled, to have reduced initiative, interest, affect. He noticed that patients in preparation for anesthesia tended to rest, but they could be readily aroused and their intellectual functioning remained intact. For this reason, Henry Labourite, the surgeon, suggested that chlorpromazine be tried in patients with severe, persistent psychiatric features in the hope that it would reduce some of the agitation, aggression, and excitement that led to these patients being hospitalized. Pierre Denneker, the frontline clinician, and his chairman, Jean Delay, did such trials in 1952 in psychotic patients and found that, in fact, agitation, aggression were decreased. But on the next slide, we note that unexpectedly, in addition, the power and intrusiveness of hallucinatory perceptions and delusional beliefs was also reduced. The patient became more in contact with the world and the individuals around them, more engaged, and their thoughts and behaviors became more organized. Heinz Lehmann brought chlorpromazine to the North American continent, suggested that chlorpromazine inhibits affective drive. So it's in this setting, looking not only at the effects of chlorpromazine and the other antipsychotic drugs on specific features of psychosis, but also in their tendencies to quiet down, to limit, to reduce agitation, to lead to a quieter, more peaceful, more placid, but still intellectually intact state that has perhaps contributed to the expanded use of these drugs. Now, in the use of these drugs as antipsychotics, they had big effects. In 1955, in the United States, 560,000 people approximately were chronic state and county psychiatric hospital residents. By 1970, that number had dropped to 340,000, and by 1990 to 110,000. The further decreases since then to numbers now well under 50,000 are probably also largely explained by the availability of clozapine since the early 1990s. So we'll talk about the expansion of use of antipsychotics in a number of areas: the elderly, children and adolescents, affective disorders, and anxiety disorders. In the elderly, a recent 2009 review of antipsychotic use for neuropsychiatric symptoms of dementia in Geriatrics, 2009, volume 64, starting on page 10, the author notes that the effects on neuropsychiatric symptoms of dementia are modest at best, and that there have been a series of label warnings of increased risk of death and morbidity when using antipsychotic drugs in this older population. Still, the author notes that a trial of these agents may be indicated in rare occasional patients in which the severity of symptoms is extreme or in which the symptoms do not respond to non-pharmacologic interventions or other medications. The author also notes that treatment with these medications need not be long-term after they're initiated if they are used to control a brief period of agitation or psychotic worsening, suspiciousness leading to anxiety and agitation. If changes can be made in the patient's environment, if other medications can then be brought to bear, the antipsychotic can perhaps be tapered away. They note that there's no evidence to suggest differences in the effectiveness of atypical, newer, second-generation antipsychotics versus conventional first-generation antipsychotics. The Canadian Institute for Health Information noted that between 2001 and 2007, the percentage of senior citizens in Canada receiving an antipsychotic drug increased from 4.3% to 5%, despite a series of warnings, health warnings, by Health Canada and by the United States Food and Drug Administration. We'll move now to discuss the DART-AD trial. That's DART-AD. The initial report of the trial was done by Ballard et al. In 2008, and it's referenced on your slide. This trial took a large group of individuals with Alzheimer's dementia receiving a first-generation conventional antipsychotic and randomly assigned these individuals to either stay on the antipsychotic or have it discontinued. There was follow-up at 12 months and then for other outcome measures out to 24 and 36 months. On the overall measures of functional and cognitive status, there were no significant group differences between staying on the antipsychotic or discontinuing it, though the authors note that these drugs may have some value in the maintenance treatment of those individuals with more severe neuropsychiatric symptoms, the most agitated, the most psychotic among the patients. But this benefit must be weighed against the side effects of therapy. Well, the key side effect of this therapy was revealed in a paper published this year in Lancet Neurology, reporting on the DART-AD trial, with the primary outcome measure being death. And they found that 12-month survival staying on the antipsychotic was 70%, whereas it was 77% in the patients switched to placebo. At 24 months, survival on the antipsychotic was 46% versus 71% on the placebo, and survival at 36 months was 30% on the antipsychotic relative to 59% on the placebo. These are all highly significant differences, and any small benefit for individual patients must certainly be weighed against an almost doubling in mortality over 3 years from continued use of these drugs. The next slide from the Canadian Medical Association Journal documents that between January of 1996 and July of 2004, there was a substantial increase in the overall number of prescriptions written for antipsychotic drugs. During this time, the number of prescriptions written for conventional first-generation antipsychotic drugs fell progressively, whereas the number of prescriptions for second-generation atypical antipsychotic medications rose quite steeply. Now, these rises in use of the antipsychotic drugs in individuals with dementia occurred despite warnings about